Wa kaunti ya Kisii Richard Mumuima ONYOKA nigakwanira obokoreri ase chinyagitari maigaye komiti Biobochenu ya Senate gokora etaro gochia ase chinsemo okwana bosio be Senate nigo nikiribuna nige etaro yabo yarentre amoncherio ase Gokinia Ebirengo Biobochenu nanya nabo nigaburire abaseneta goikirana ase binyoro eleko nekebuna Ebirengo Biobochenu ngokinabire ase CHINYAGITARI.
I was in Kiambu County yesterday, and we have visited several counties like my colleagues have said. Mr. Speaker, the situation is not helpless. I was actually surprised that when we visited Kiambu County, even when we found the challenges and the mess that was at the referral hospital, where the kitchen doesn't even have equipment and machinery, the ceilings are collapsing. Mr. Speaker, I was shocked that patients in Kiambu Hospital have never eaten meat. Patients are never given an egg, or do we have sugar? I mean, it was really a very, very painful scenario. Even though that was the case, Mr. Speaker, there was also very good information from Kiambu County Health Services. Why? Because they have done 24 level 3 and level 4 hospitals, which are all brand new. We visited those facilities, and Mr. Speaker, they were quite impressive. The governor has officers, some of them who have worked very well, but some of them have been a problem. Some of them have gone and opened hospitals, their own personal hospitals in Ruiru and in Thika. Some of the medicines are found there, and I want to mention to this, Mr. Speaker, I have a very special request to make to my colleagues. We need to get out of this building and go to the counties, Mr. Speaker. Every single place we have visited, we have seen that there were changes.